Hello, I'm Dr. Fred Venditti. I'm the Hospital General Director here at Albany Medical Center, bringing you the update today. It's April 8th. I'm joined today by our new CNO, Dr. Lisa Massawi. She joins us from California, originally I think a Pennsylvania native,
girl.
so
yep.
she's used to the Northeast, but has spent a number of years in California. I'll let her give her background in a little bit. Let's jump to the numbers. Let's go to the first slide. This is the hospitalization numbers for the Capital Region. And once again, Lisa, it's flat. We're at 101 inpatients today. We've been there since March 5th, so
Great
we
news.
Continue to hover. Yeah, it is good, considering the fact that the variants have grown dramatically in the region. So that's really tremendous. Let's flip to the second graphic. This is the admissions and discharges, and you can see that it's basically in balance. We're having a few admissions every day and a few discharges that are equal. So we stay at a relatively stable census, and that's the third graph. You can see our census here. Today we actually had 27 inpatients, 13 in our ICU, 4 on ventilators, and 5 of those patients are non-infectious. So, and actually a couple of those were in the ICU. We did have a bit of good news yesterday. I was telling Lisa when I first walked in, one of the patients who'd been on a ventilator for over 2 months was extubated yesterday.
That is absolutely fabulous news.
It is a long, long haul for that person. You know, we wish them well, but they were able to get off the ventilator after all that time, so that's really tremendous. Let's flip and talk a little bit about vaccines for a moment. It's always something we want to make everyone aware of. It's important to get your vaccine. Looking on the state website today, it's really quite amazing. 409,000 doses have been administered in the Capital Region. So those
are first doses.
First doses,
yeah.
yes. So that's almost 40% of the population here in the region.
Isn't that amazing?
It is. It's terrific. And 269,000 people have had a complete series. So either one of the J&J, if they've gotten J&J, or 2 of the others that are available, the Pfizer and the Moderna. So we're well on our way. If we need 75 or 80% of people to be vaccinated for herd immunity,
we're getting there.
Yeah, we're halfway there. So that's really tremendous. There was a bit of news yesterday in the New England Journal. Again, we were chatting about this in terms of the duration or durability of response to the vaccines. So this was a correspondence on the Moderna vaccine, where they looked at the titers of antibodies, so the antibodies against the virus, after vaccination and how long they lasted. And they tested a group for up to 209 days, and they still had high titers.
So 6 months out.
So a little bit more than 6 months out. So, and that's as far as they went. So we know that at least that far.
Maybe more.
Maybe more. And last week we talked about Pfizer. There's data that Pfizer is effective at 6 months as well. So again, keep your fingers crossed. Everything is going in the right direction, and that's really quite terrific. So as I said, Lisa's our new CNO. Lisa, you've been here not quite 2 weeks.
Not quite 2 weeks.
Going to put you on the spot anyways. Tell us a little bit about yourself first, and then tell us about what your plans are, or how you're going to go about changing things here at the medical center.
Well, I think changing things takes a team. But a little bit about myself. I grew up in northwestern Pennsylvania, so the Rust Belt area. I am not new to the winter weather here that everybody asks me about. Hopefully I'm bringing some California sunshine out and some warmer weather. I'll have to get used to driving in it again after almost 20 years, but like I said, grew up in Western Pennsylvania. I went through a diploma program, so I did it very much like Albany's history here, and went through a diploma program, and then a master's degree in nursing administration from Gannon University, and my doctorate degree at University of San Francisco out in California. I have a wide background from pre-hospital care to med-onc to acute hemodialysis, ICU, CCU, CVICU, and administration. So I am very excited to get to know the nurses and the caregivers here, work collaboratively as a team, and grow on our quality and safety of our care and the excellence that we provide. Albany's got a very rich history of nursing, and I want to learn more about the history and honor that history as we look to the future, as we focus on our quality initiatives and the professional practice of nursing. So please welcome me to Albany, to the community, to the medical center. Please share with me things that you're passionate about, things that drive you, excellence in the medical center, excellence in the community, places that I should get to know. I'd appreciate that.
So Lisa, looking at your schedule, you're meeting with a lot of people,
Yeah.
getting to know leadership, and really a little bit more about the place, which I think is very important. So that's really terrific. You know, you mentioned quality as you were talking a little bit about yourself, and it is something that's very important to us. We have a very strong quality program here at the medical center, and there are lots of aspects to that. One of which is length of stay. And so I'm leading into
Yep.
the last
Yep.
graphic that
Yep.
we're going to show, which will pop up on the screen. On Thursdays, we show the length of stay. And you can see here that the length of stay is coming down, particularly the COVID portion of it. So the top line is total length of stay, and the bottom line is the length of stay for those patients without COVID. But Lisa, improving on length of stay is valuable for our patients for a whole host of reasons, right?
Absolutely. We know that hospitals are great places to be if you really need to be here, but home in a healing environment with your family is an even better place if you can be home safely. And our nurses are at the forefront of that care delivery every day, every hour. Nursing is the most trusted profession, in my opinion. And so I really think that we have so much to contribute to the quality of care of our patients.
Absolutely, I agree with you 100%. Nursing is the most trusted profession, absolutely. Well, welcome to Albany.
Thank you.
We're really happy, and I am particularly happy to have you here as my partner and working here in the medical center. So I look forward to that as we go forward.
And I look forward to meeting everybody. So please say hey as I'm out and about, and we have more conversations.
Great. Well, I think that does it for today here from Albany Med. As we always like to say at the end of this video, take care of yourself and take care of each other. We'll see you next week.
Bye-bye.